Looking for ways to relieve cervical radiculopathy? Well, this is the video for you. I'm going to show you some simple stretches and exercises. So let's get started. So cervical radiculopathy is ridiculous, but seriously, it can be caused by inflammation in the neck area at that nerve root, from a herniated disc, from disc degeneration or arthritis, or even something like stenosis. But in general, that's when it puts pressure on that nerve and it can cause numbness and tingling down into your arm. So some great ways to get your neck loosened up and get your muscles stronger will help make it less tension and putting pressure on that nerve. I'm going to be doing a stretch with a towel, so make sure you grab a towel. It doesn't have to be anything too big, just maybe something like this, a kitchen towel. It can be a little bit longer, so if you don't have that nearby, hit the pause button and go grab that. I'll be using that later. So the first one is just going to be a chin tuck. Chin tucks are one of my favorites. If you've seen some of my neck videos, my posture videos, I really like chin tucks. They really help kind of reset everything and kind of get good posture in your neck, because sometimes that's what can cause the radiculopathy as well. So a chin tuck in general is not necessarily tucking down. We'll be adding that in a little bit, but this chin tuck is the one where you're just kind of bringing your chin back and in. So you want to keep your chin in a kind of a neutral position. So it's not up, it's not down, but you're keeping everything level. I like to use the finger as a target sometimes if you're first starting out doing it, because it helps you kind of figure out what you're supposed to be doing. So just kind of placing your finger on your chin, and you're really just pulling that chin away from that finger. Almost like if I was against a wall, I'm trying to bring my whole head back against that wall. You might get a couple little chins there. You know you're doing it right if you can. Hold it for about 3 to 5 seconds and then relax. So I get some big movement because I do chin tucks almost every day to keep my neck healthy. But when you're first doing this, if you haven't done it in a while, you might not go very far. You might just get just a little movement in there. But the finger is there a lot of times. It's nice because if you come back and you're holding it for 3 to 5 seconds, when you relax, if your muscles have been really tight, you can see a little bit of a difference there. And that's just showing that those muscles are resetting. So holding it for about 3 to 5 seconds and maybe doing 5 or 10 of those. So the next exercise is going to be what I call a double chin tuck. So this is now going to be a combination move, kind of adding on to the original chin tuck. So make sure you're mastering that one before you try this one. So really all this is now it's a chin tuck going in and a chin tuck going down towards your chest. But it's not going to be a big movement, because once you go into that first chin tuck, you're not going to have a lot of movement there. But this is going to activate those deeper neck flexor muscles, which really helps stabilize the cervical spine, which is going to take pressure off of the disc area or the vertebrae to help relieve that radiculopathy pain. So all I'm doing now is I'm going into that first chin tuck and then I'm bringing it down. So you can see that's not a very big movement, going in and then trying to bring that chin down towards the chest. So this is what I'm doing, but once I go into the chin tuck, you're not going to have that much movement. So make sure you get a good chin tuck first, and then you're tucking that chin down. So that's kind of why I call it the double chin tuck. You don't have to really hold it for a long time, because this is kind of an exercise, but if you want to do a little pause, you can go into that chin tuck down. You can keep the first chin tuck and just do those, but that is a little more tiring than it looks. So if you want to reset every time for that one, you can, because it is a little bit tougher than the others. You might just want to start off with like 3 or 5 and then kind of work your way up from there. So then the next ones are going to be some isometric exercises. With that radiculopathy, a lot of times the bigger movements are what reproduce that pain, especially that nerve pain down into your arm. So a lot of times isometric exercises where you're activating the muscles but you're not moving really helps start getting the strength back in those muscles without causing as much pain. So the first one is just going to be isometric cervical side bend. So the motion that I would be doing is this side bend motion, but I'm just going to use my hand or or my fingers or the palm of my hand just to prevent my head from doing that. So this is the motion I would be doing, and then I'm just going to kind of place my palm on my temple here, and now I'm just pushing in. You can see those muscles activating, only going about 30 to 40% starting off with. So you're not pushing in as hard as you can, but you just want to activate those muscles. And then you're going to hold that for 3 to 5 seconds and relax. I like to alternate sides. So again, this is the movement I'm doing, that side bend, but I'm just preventing myself from doing that movement. I'm holding it there If you do it for a while and it's starting to get, a little bit less pain, then you could start here and then do that then. So you're getting a little bit different angles, but you're still doing that isometric motion in those spots. Again, I like to kind of alternate back and forth each side, holding it for about 3 to 5 seconds, maybe doing 5 on each side. And then you're going to do an isometric rotation. So then the motion I'm doing rotating this way, but my hand's going to be in the same spot, just kind of the palm on my temple. And now I'm rotating in, and you can see again, those muscles are activating, but I'm not doing a big movement where it might cause a little bit of pain. So I'm just, again, kind of activating it 30 to 40%. After you've done them for a week or two, if you want to go a little bit more, as long as it's not painful, you can. And then maybe 5 on each side. So then the next one, this one often helps relieve some pain because you're opening up those joint spaces where those nerves are coming out, the canals where their nerves come. If you are rotating away, so if this is the side where the radiculopathy is on this side and it's painful, I'm just going to do an opposite rotation. So if I'm painful over here, then I'm just going to rotate away, and that helps open up that joint a little bit, and then I'm going to come back. So this is all I'm doing. I'm not necessarily holding unless I want to, but I'm doing a contralateral movement or opposite movement away from the pain. And a lot of times that kind of helps open everything up. It's a little bit of a nerve glide, a modified nerve glide as well. So a lot of times this kind of helps get that movement in there where that irritation is on that nerve root. It will kind of help calm that down because you're increasing circulation to the area to help calm down that pain. So again, just 5 or 10, nothing, super big, but if it does end up causing more numbness and tingling in there, go ahead and hold off on that one. So then the next one is the one where you're going to use your towel. We call these SNAGs. It sounds kind of funny, but it's just a way of getting a nice stretch, but being able to stabilize or hold a segment at one time. So kind of imagine that, if this is my cervical spine here, I'm using the towel to kind of stabilize this part, so then I can rotate here. So instead of just doing a general stretch, which is great, this kind of helps get that specific spot where I want to kind of open up those joint spaces there. So all I'm going to do is I'm taking my opposite hand and grabbing the towel here. And if you're going the other way, same thing. So I'm holding here. And then I'm going to take the other side and bring the towel kind of up towards my ear. So not down towards your neck, just up towards your ear here, along your jawline. And I'm pulling up and over to help rotate my neck. And then with this hand, I'm just kind of stabilizing, or I'm pulling downwards a little bit so it can kind of hold that vertebrae in that spot. So I'm pulling down with this side over here, and then I'm coming up and over and rotating to get that stretch in there. And this is a really nice stretch. I'm getting a good stretch in here. It's a little uncomfortable because I'm pulling down with this one and pulling up and over with this one. So if you can't go the full 30 seconds, that's okay. But really, if you can, try and do that. And then so I'm holding here, coming up over towards my ear and my jawline, pulling down with this hand and up and over with this hand. And I'm getting a nice, good stretch in there. You might even feel a little pop or two while you're doing that. And so ideally you do that 3 times on each side. So then the next one is just going to be a simple shoulder squeeze or scapular squeeze. And so this is really just kind of to open everything up, because a lot of times if it's not a specific radiculopathy, it can be from posture where you're kind of going in, pulling your neck forward and putting pressure on that area. So opening everything back up like a shoulder squeeze is a really simple, easy way to get that opening up in there and kind of reset everything. So all you're doing is imagine someone has their hand on your spine and you're just trying to squeeze it together with your shoulder blades. When you're first doing this, just to really kind of guide those shoulder blades, if you're not quite sure what to do, you can use your elbows to squeeze back, but you're not just pulling back with your elbows. You're using those muscles to squeeze back. Try and keep your shoulders down and really get that squeeze. I'm trying to squeeze. I'm trying to use those muscles, those rhomboid muscles back there to pull those shoulder blades together. I can do a little pause and then relax. Once you get it down a little bit, you don't have to use your elbows, so you really know you're using your muscles and you're just squeezing back. Again, trying to keep those shoulders down, squeeze, maybe hold it for 2 or 3 seconds, come back. And then again, if you want to do something like for time, do as many as you comfortably can in 30 seconds. And then we're just going to do a modified nerve glide. So with radiculopathy, the nerve is involved, it's getting compressed, that nerve root is irritated, and so a lot of times if you can glide that nerve, that'll help improve the circulation to the area and calm all that inflammation down. But you don't want to overdo nerve glides because you actually can irritate it even more. So I always say maybe just do 1 set of 10 once a day and see how it does. This is a modified one, so it's not quite as intense. So if it feels really good, you could possibly do twice a day, but I'd still just do 1 set of 10 at a time. So if I want to glide this side of my nerve, what I'm doing is I'm going to imagine that there's a string on my finger attached to my head. So they're following each other. I'm bringing my arm up as far as I comfortably can. So if the nerve pain is on this side, you might have to go a little bit lower. But if you can hold it up to about 90 degrees, that's where you want it. A little bit lower is fine. And then I'm looking straight forward, and I'm just, as I bring my arm straight, my head is following it. So they're connected, and I come back up, and my head comes up. So I'm just going down and then coming back up. This might reproduce some of that tingling, some of that numbness. That's okay if as soon as you stop, then all that sensation comes back and the tingling stops. If it seems to be lingering on, you might not quite be ready for the glides yet. So there you have it. That was some ways to relieve cervical radiculopathy. If you'd like to help support my channel, click on the link up there, and don't forget to subscribe by clicking down there. And remember, be safe, have fun, and I hope you feel better soon. Cervical radiculopathy.